Some people are accusing government officials and media of overreacting and fear-mongering. Orders to stay at home and socially distance are to prevent devastating surges seen in places like Italy and New York that our local healthcare infrastructure will not be able to handle. Dr. Lina Miyakawa, John A. Burns School of Medicine graduate, now working in New York at Mount Sinai Hospital Intensive Care Unit, said she has never seen anything like it before and is afraid Hawaii is not prepared. She said the amount of resources we have in New York, it's huge compared to what we have in Hawaii. If this disease hits Hawaii the way it hit New York, there's no way Hawaii can deal with it. Absolutely not. I hear young people say they are not worried because only old people get sick or die from this. Before local businesses were shut down, I was in a pancake restaurant trying to eat a soggy vegetarian omelet, leaking water from the partly thawed frozen vegetables in it. A young man sitting at a nearby table was talking and laughing with a waitress. He loudly mocked anyone worried about the virus. He and the waitress agreed flu is worse. Is flu worse? Dr. Vinaya Kumar reported for ABC News that COVID-19 is worse than flu. He said COVID-19 is more deadly and spreads more quickly than flu. In March, Dr. Anthony Fauci, director of National Institute of Allergy and Infectious Diseases, said COVID-19 is more than 10 times as lethal as the flu. Dr. Kerry Kennedy Meltzer, internal medicine resident at a New York City hospital, writing for The Atlantic, wrote, "Young people with no clear underlying health conditions are getting seriously ill from COVID-19 in significant numbers." She said, "A doctor at my own hospital said he has never seen so many young people in the ICU as he's now seeing with COVID-19. Allie Watkins reported for the New York Times. A Brooklyn paramedic said it's all a war zone. A New York City paramedic who assisted during the September 11, 2001 terror attacks and served in the Iraq War said about COVID-19, "I'm terrified. I honestly don't know if I'm going to survive." New York City's 911 system typically sees about 4,000 emergency medical services calls a day. It's now overwhelmed by medical emergency calls, more than 7,000 calls in a day. Paramedics are doing it in most cases, they say, without appropriate equipment to protect themselves from infection. Michael Squirts reported for New York Times. A supervisor urged surgeons at Columbia University Irving Medical Center in Manhattan to volunteer for the front lines because half the intensive care staff had already been sickened by coronavirus. Dr. William P. Jackies, president of the American College of Emergency Physicians, said doctors are getting sick everywhere. An emergency room doctor at Long Island Jewish Medical Center said it's literally wash your hands a lot, cross your fingers, pray. Hospitals are seeing dwindling equipment, growing numbers of patients, and doctors and nurses who are themselves becoming infected. Ed Young reported for The Atlantic that in Italy and Spain, hospitals are out of room supplies and staff. Unable to treat or save everyone, doctors have been forced into the unthinkable, rationing care to patients who are most likely to survive while letting others die. Josh Jamonk reported for The Atlantic that 1 week Italy had 322 cases of COVID-19. The next week it was 2,502 cases. The week after that it was more than 10,000 cases. Doctors and nurses were not able to tend to all of them. There was also not enough ventilators for all who needed them. Italian College of Anesthesia, Analgesia, Resuscitation, and Intensive Care published guidelines for criteria doctors and nurses should follow as these extraordinary circumstances worsen. Authors of the guidelines are medical doctors. They had recommendations for how to manage these impossible choices, such as it may become necessary to establish an age limit for access to intensive care. They also advised taking a patient's overall health into account. Presence of comorbidities needs to be carefully evaluated. Examples include diabetes, heart disease, cancer, COPD. Will some people maybe over 60 with diabetes, heart disease, or other chronic disease or cancer not pass a review for intensive care or ventilators if there is not enough for everyone who needs them? On March 31st, Rachel Maddow on the Rachel Maddow Show reported New York City's mayor and New York State's governor were sounding the alarm that there is not enough medical equipment, especially ventilators. She said, Wall Street Journal reported, Langone, one of the nation's most prestigious academic medical centers, was telling their frontline doctors they are going to have to start thinking about the fact that they may have to deny some of their patients access to ventilators because there are not going to be enough ventilators. This does not happen with the flu. COVID-19 is worse and deadlier than flu.